Hello, my name is Lorna Sullivan. I'm a nurse practitioner student at Auburn University. Today I will be performing a head-to-toe assessment on my volunteer, Jeremy. And prior to walking in the exam room, I assessed his height and weight, and also his blood pressure, pulse, temperature, all of his vitals. And we did the visual acuity test using the Snellen eye chart, and his vision was 20/20. Okay, getting started, he appears well groomed. He is warm to touch. No signs and symptoms of distress noted. I'm going to start off by palpating your head and let me know if there's any tenderness. Any tenderness? Okay. Head appears normocephalic. Hair is well distributed. There are no lumps or masses noted. I'm going to palpate your sinuses. I'm going to do your frontal, any tenderness, and maxillary, any tenderness. Right. I'm going to palpate TMJ. Open your mouth for me and close. All right, no clicks heard. Now I'm going to palpate your lymph nodes. We'll do occipital, post-auricular, pre-auricular, carotid, tonsillar, submandibular, and submental. Then we have the anterior cervical, posterior cervical, and the pre-clavicular. Right, and no lymph nodes were noted. Now we're going to test cranial nerve number 5. And close your eyes for me. And do you feel that? And is it soft or sharp?
Soft.
Okay, keep your eyes closed. Just let me know if you feel this and if it's soft or sharp.
Sharp.
Thank you. Alright, you can open your eyes. So cranial nerve number 5 is intact, and now we're going to test cranial nerve number 7. If you can lift your eyebrows, good, and close your eyes, and show me all your teeth, and smile, frown, and puff out your cheeks. Good. Cranial nerve number 7 is intact. Now I'm going to look at your eyes, eyebrows intact, hair is well distributed, eyelashes well distributed, and they are pointing upwards and outwards. Now I'm going to look at your eyes. Okay. The pupil is equal and round, reactive to light. And I'm going to get you to look up for me and down. Sorry. And up and down. Down for me. Okay. Now I'm going to do a more in-depth assessment. Look at me. Perfect. So the red reflex is present, sclera is white, conjunctiva is pink. There's no arterial narrowing, so everything looks good there. And now we are going to test cranial nerves number 2, 3, 4, and 6. So I'm going to have you cover your left eye and look straight ahead, and let me know whenever you see my fingers.
Fingers. Fingers. Fingers. Fingers.
Okay, and we're going to do the opposite eye, and let me know when you see me.
Fingers. 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 Fingers.
Perfect. Now, and that was testing your peripheral, and then also I'm going to get you to cover your eye, one of them, and then just look straight ahead and look at head. Perfect. And the other one? Perfect. So there is no misalignment of the eyes. And then now I'm going to do the cardinal gaze test to test your movement. So just follow my finger. Perfect. So cranial nerves 2, 3, 4, and 6 are all intact. So now I'm going to look at your nose. Septum is midline, and there is nasal hair noted, well distributed. Mucosa is pink, no drainage, exudate noted. And the turbinates are also intact. We're going to test cranial nerve number 1. I'm going to get you to close your eyes and let me know what you smell. Smell anything?
Alcohol.
Okay, good. So cranial nerve number 1 is intact. Also, I'm going to test your patency. So if you can just cover one nostril and breathe, and then the other. Perfect. So both nostrils are patent. And now we're going to look at your lips. They are pink, moist, and pull down your lip for me. Perfect. And then I'm going to get you to open. Oh, okay, and then tongue side to side. Tongue down. Okay. I'm going to test your gag reflex. So say ah. Okay. Gag reflex is present. Cranial nerve 9, 10, and 12 are also intact. Now we are going to assess your ears. Any tenderness noted? All right, there is no deformities noted on the ears. Any tenderness here? Perfect. All right. So I'm going to look inside your ear. Okay. The malleus and incus are present. Tympanic membrane is pearly gray. There is no obstruction in the ear canal. Okay, I'm going to hold this one as well. Also, malleus and incus present, no obstruction in the ear canal. Tympanic membrane is a pearly gray. Okay. I'm going to do something called a whisper test. We're going to test cranial nerve number 8. So I'm going to go behind you and whisper something in your ear and let me know what you hear.
War eagle.
Good. Perfect. Cranial nerve number 8 is intact. Okay, now we are moving on to test lateralization. I'm going to perform a Weber test. I will strike this. I'm going to put it on your head and let me know if you can equally hear it in both sides. No, still not vibrating. Can you hear it equally? All right. So I can get a better strike. Okay, I'm gonna put this on the I'm sorry, we're gonna start over on this one. Let me explain it to you first. I'm going to put this behind your ear. Let me know whenever you stop hearing it. I'm gonna bring it to the front, and then let me know whenever you stop hearing it as well, okay? Okay, so air conduction is greater than bone conduction, which is great. And we are going to do that again on this side. I'm not sure I can do this. So air conduction is greater than bone conduction. Okay, we're going to move on to the neck. There are no abnormalities noted, no lumps or masses. Skin color is appropriate for race. And now I'm going to palpate. The trachea is midline. And then I'm going to palpate your carotid. Carotid is palpable 2+, and carotid is palpable at 2+. Okay. I'm going to come behind you and test your thyroid. Okay, and swallow for me. Okay. Thyroid does not appear to be enlarged, and there's no nodules noted. We are going to test the range of motion of your neck, and we're also going to test cranial nerve 11. So if you will look side to side for me, and other side, and then up and down, and now go ear to shoulder on each side. Okay, and shrug your shoulders and push against, you can relax, and push against my hand. Okay, and again. All right, he has full range of motion, and cranial nerve number 11 is intact. So now we are going to move on to the posterior thorax. Stethoscope. Okay, I'm going to lift up your shirt. All right. So I'm just first observing for respirations, and they appear to be unlabored. He does not appear to be any respiratory distress at this time. The skin is consistent color with the rest of his body. It's normal for ethnicity. There is a tattoo noted to his right shoulder. And now I'm just going to palpate for any tenderness. So just let me know if any of this hurts, any pain. All right. Now I'm going to look at your chest expansion. So take a deep breath for me and exhale. Perfect. There is equal chest expansion. And now I am going to percuss. Percussion appears to be resonant. I'm also going to check for a tactile fremitus. So if you would, each time I place my hands on your back, just repeat the words 99. Okay, go.
99.
Again.
99. 99. 99.
Okay. Vibrations are equal to both sides. And now I'm going to test for CVA tenderness. So just let me know if this causes you any pain. Is that okay? Is that okay? All right. Now I'm going to auscultate the lung fields. Okay, take a deep breath. Sorry, and one more time on this side. Perfect. So lungs are clear and equal bilaterally. There was no adventitious sounds noted. Alright. Okay, and now I'm going to assess your chest. If you would, lift your shirt for me. Okay. There are no deformities noted, no masses. Skin is warm and dry to touch. There is a tattoo to this right chest wall, and there are no pulsations noted either. All right, so now I'm going to do the same thing that I did from the back. We're going to start off, any tenderness. Okay, we're gonna do the 99 test again. So just say 99.
99. 99.
A little bit louder.
99.
Perfect.
99.
Okay, equal vibrations noted, and I'm going to percuss. Okay. Sounds good. And now I am going to auscultate as well. Deep breath. Perfect. And again. Okay. Great. Lungs are clear and equal bilaterally. No adventitious sounds noted. And I'm going to go back to do your diaphragmatic excursion because I did not do that earlier. Okay, so what I want you to do is take a deep breath in and hold it for me. Deep breath in. Okay, and release. Perfect. And now I want you to take a deep breath in and exhale and hold that exhale. All right, perfect. So the diaphragmatic excursion appears to be about 4 centimeters. Okay, now I'm going to auscultate heart sounds, and I already inspected the chest, and then I also palpated for any tenderness. And I'm going to go over here this time just so I can hear. So we're doing aortic, pulmonic, second pulmonic, tricuspid, and mitral. Okay, now I'm going to listen with the valve of my stethoscope. Aortic, pulmonic, second pulmonic, tricuspid, and mitral. Okay. S1 and S2 are noted. There are no extra heart sounds or murmurs noted. Alright. And now we are going to move on to the abdominal assessment. And also, before I do that, look straight at me. I do not see any external jugular venous distension. So I'm going to lay you back. And this is as far as this goes. So come on back. I'm going to pull this out for your legs. So I'm just inspecting the abdomen, and it is flat. Skin color is appropriate with the rest of the body, and there are no notable deformities. And he is warm and dry to touch. And we are going to auscultate his bowel sounds first before we do anything else. Bowel sounds are active in all 4 quadrants. I'm going to go ahead and auscultate his aorta. And renal arteries. Iliac. No bruise noted. Also at this time, I'm assessing for internal jugular venous distension, and that is not noted. And at this time, I'm going to attempt to palpate his apical pulse, which is located mid-clavicular 5th intercostal space. And I am able to palpate his apical pulse. Next, we're going to do some percussion on your abdomen. So I'm just going to do all 4 quadrants first. Sorry. am going to percuss the liver span. Span appears to be about 6 centimeters. And now we are going to do some light and deep palpation. So would you please just let me know if you feel any pain or discomfort? Okay. Okay, no discomfort with light palpation. I'm going to go a little bit deeper this time. Does that feel okay? It's good. Okay. There was no tenderness noted. I did not see any guarding whenever I did palpation. Now I'm going to attempt to palpate some of your organs. We'll start, since I'm on this side, with your spleen. Unable to palpate the spleen, and we will try the left kidney. Unable to palpate the left kidney. And the liver. Okay, I'm able to feel the edge of the liver. And right kidney, I am unable to palpate. I'm going to do an abdominal reflex. All right, the abdominal reflex is intact. Next, I'm going to attempt to palpate inguinal lymph nodes. And then I'm also going to palpate your femoral artery. Okay. Not able to palpate any inguinal lymph nodes. Okay. Femoral pulse is present, 2+. And it is also present on the left side. Thank you so much. I'm going to get you to sit back up for me. All right. I'm going to assess your arms. Muscle tone appears good. He's warm. Skin color is appropriate. There are no rashes, lesions noted. And we are going to go ahead and palpate your brachial pulse. That is present. And present on this side as well, 2+. And radial. That is present at 2+. And present at 2+. Okay, look at your hands. I'm going to do capillary refill. Capillary refill is less than 3 seconds on the right and also on the left hand. Any tenderness? The arms, elbows, any tenderness to your hands? So I'm going to test for coordination really quick. So if you would just flip your hands. Okay. And then finger to nose really fast. Good. Coordination is good. I'm going to get you to close your eyes. I'm going to put an object in your hand and let me know what you feel. Paperclip, correct. So I was checking stereotomus, and it is intact. So now we are going to check your reflexes. Alright, so I'm going to do brachial, I'm sorry, I'm going to do bicep first. And just relax. Perfect. And tricep. Relax. And one more time. Perfect. Good. Reflexes intact. And we'll do the side. Relax. Okay. Tricep. This is the brachioradial reflex. Okay, perfect. Alright, and do patellar reflex. So just relax your legs for me. Perfect. Perfect. Alright, and now we're going I'm sorry. Okay. We're gonna do okay. And Babitsky. This one, just relax. That was the Achilles reflex, and now Babitsky. There you go. Good. Reflexes are intact. Okay, now you're going to do range of motion of your arms. So if you can bring them up, down, in front of you, all the way up, down, and if you can reach to your back. Again, that one. Okay. And then that way. Perfect. And so full range of motions to the shoulders, and then we're going to do your elbows, so just flex. Okay, and release. Perfect. Now for your wrist, you can relax. For your wrist, just inward, up, and then perfect. And your fingers extend out, nipple in, out, spread them apart, now together. Perfect. Okay, he has full range of motion to the shoulders, elbows, and hands. So now we are going to move on to the legs. I'm sorry. Before we move on to the legs, we are going to test for sensation of his arms. So just close your eyes for me, and whenever you feel this, feel that? What is it? Soft? Okay. And again. Okay. Right. And I gave you chill bumps. And whenever you feel this, sit sharp. Okay. Okay. Perfect. And I'm going to test vibration. Feel this. Sensation is good. Okay, now we're going to move on to the legs. Legs appear muscular, no deformities noted, no masses, rashes, hair is well distributed, and appropriate venous noted. Now we are going to palpate your popliteal pulse. You can relax. Okay. And move down. This is the posterior tibial pulse and the dorsalis pedis. Those are palpable, 2+, and posterior tibial and dorsalis pedis. And while I'm down here, I'm gonna take his socks off and just assess his feet. And his feet look fine. There is nothing abnormal noted to his right foot and left foot. Looks okay. The toes look fine. They're a little cold, but nothing abnormal noted. I'm going to go ahead and test sensation of his legs and feet as well. Close your eyes. Let me know if you feel it and if it's soft or sharp. Okay. Okay. Uh-huh. Uh-huh. Correct. Okay, he has full sensation of his legs and feet. All right. So now we are going to do range of motion. So, if you would just stand up for me and we'll do this part. Okay, so we'll start with the hip. So if you'll just pull this one, abduct your right leg and your left. Okay, now bring them out, right foot, and left. Okay, and hyperflex to the back, so come up a little bit and just one back. Yes, correct. All the way up, like this. Sorry. Okay, and the left. Okay, and then internal rotation. So just do this. Right. Okay, and do that towards the back. And come back. Good. And other side. Okay, and other side. Good. And now just bend your knees. Okay, so full range of motion to the hips and knees. All right, you can sit down for me. Okay, for your ankles, can you just pull down for me? Okay, then up. All right, and gotta go sideways. There you go. Okay, and I want you to push down on my hands as I push resistance to test for straight. Good, and the other way, push up against my hand. Perfect. Now I'm gonna put my hands back here and push against my hand with your legs. Good, strength is good, and pull, push up against my hand for strength as well. Perfect. So strength is good to the bilateral lower extremities. Now I'm going to get you to stand back up, and I am going to look at your spine. So stand feet together. Okay. Spine appears to be straight. Okay, now I'm going to get you to touch your toes. We are testing for scoliosis. Spine appears straight. I don't feel any curvature to the spine. Okay. Now testing the range of motion of your spine. This way, and bend to the right side and the left. And then we are bend just a little bit frontwards right here. Okay, and now back. Okay, good. All right. Now you can look at me. We are gonna do the Romberg test. So put your hands up and then just look at me. There's no swaying noted. Now close your eyes. Right, no swaying noted. Now I'm going to, okay, assess your gait. Just walk as normal. Okay, and come back. Okay, now I want you to walk heel to toe. Test your balance. Okay, now walk back to me on your tiptoes. Perfect. Okay. He appears to be in good health. The assessment was normal, and that concludes my head to toe assessment. Thank you, dearie.